Well, everybody, this is Gary. Today is October 11th, 2021. It is 4:27 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my coping with schizophrenia blog entry for today. In the middle of the night last night around 1 a.m., I did a live stream. It only lasted for a few minutes. I was in a lot of distress. I hadn't slept in about 2.5, 3 days. I was really agitated. My hallucinations were really bad. My anxiety was really bad. My depression was really bad. My paranoia was really bad. I was physically very restless and agitated. I was feeling a lot of physical pain in my muscles, in my neck and my head. I wasn't sure if I should go to the psych emergency room or the emergency room for my physical pain because I didn't know what was going on. I didn't know if I had the flu and I was having body aches from it, or maybe from COVID-19. But I was able to avoid going to the emergency room. The psych emergency room at the University of Rochester, New York Strong Memorial Hospital is a total shithole. Going there can be just as stressful as not going there. It's total chaos. There's people yelling and screaming. It's overcrowded. It's a locked ward. If you go there voluntarily or involuntarily, you don't leave until you see a psychiatrist. And they do one of two things. They either admit you into the hospital or they let you go. The last time I went to the psychiatric emergency room voluntarily, I'm the one who called the ambulance. I stayed there for 26 hours because there was 45 people and a space that was meant for about 20 people at the max. And even with 20 people, it's awfully crowded. And I spent 26 hours waiting to see a psychiatrist. And during that entire time, they gave me 2 Ativans, which are tranquilizers, 2 Klonopins, which are tranquilizers, Seroquel, which is an antipsychotic, Zofran, which is an anti-vomit medication, and they gave me Zyprexa, which is for antipsychotic medication. So I spent 26 hours sleeping on a chair because there are no beds in the psych emergency room. You sleep on a chair that folds outward like a bed. And they're all right next to each other, and there was 45 people in there. And it was just as stressful to be there as it was not to be there. I resisted the urge last night to go to the emergency room for any reason. I didn't get any sleep last night, but I was able to take some Klonopin and Zyprexa. Klonopin for anxiety, Zyprexa for my psychosis. And I was able to calm down enough to not need to go to the psychiatric emergency room. If I had gone to the psych emergency room, it would have just fucked up my whole schedule. Because once you're there, you don't know when you're getting out. And I have appointments that I have to keep. I have an appointment with my crisis therapist tomorrow, and I didn't want to miss that. She's a new therapist, and I didn't want to miss my second appointment with her. I had an appointment with her last week. And knowing that I'm seeing her tomorrow helped me stay out of the psychiatric emergency room. I suspect I'll get some sleep tonight because I'm feeling calmer. My hallucinations are less intense, although they're always there. Auditory hallucinations. My paranoia's calmed down. My anxiety's calmed down. My depression is less. I'm feeling less stressed. I'm less physically agitated, less angry, a little bit more stable mentally. I struggled all night with whether or not I should go to the psychiatric emergency room. I really, really felt like shit. There was a lot going on inside my own head and in my body. But I was able to make it to the pharmacy and pick up the Klonopin and take the Zyprexa with the Klonopin. to curb my hallucinations a bit, my paranoia, and my anxiety. Those three things together are the main reason I was considering going to the psychiatric emergency room. I've learned that psychiatric emergency room, and actually any psychiatric emergency room in the Rochester area, is total chaos. Um, the psychiatrists and the social workers are not mind readers. I don't think they successfully prevent people from becoming violent or from prevent them from committing suicide. It's very easy to go into the psychiatric emergency room, act calm, claim that you're not violent, claim that you're not suicidal, unless you're on drugs and you're just completely out of it, and it's obvious that you're violent. But even then, I've read news reports of people going to the University of Rochester's Strong Memorial Hospital psych room and getting released and committing violent acts after they're released. I was just reading an article, I think it was from Genesee County, from last year. The chief of police or the sheriff or somebody in Genesee County um, did what's called the mental health arrest and brought somebody to the Strong Emergency Psychiatric Department, and Strong Memorial discharged them. They were placed under mental health arrest because they were smashing windows in the downtown area of one of the towns in Genesee County, and he was taken to psychiatric emergency room at Strong Memorial Hospital. He was released, and the police were not told he was released. They had asked Strong Memorial Hospital to tell them if he was going to be released, and they didn't tell the police that he was going to be released. And he proceeded to go home and smash his head into a window, and he had to be arrested, but not under mental health arrest. He was arrested for criminal charges and brought to jail. And the Genesee County sheriff or chief of police or whoever it was said they were going to stop bringing mental health arrest patients to Strong and instead bring them to Rochester General Hospital, which is run by Rochester Regional Healthcare. Both Rochester Regional Healthcare and the University of Rochester put out statements saying that it was unfair for the police to criticize them, that they don't have a crystal ball, they can't always predict what's going to happen with mental health patients. And Rochester Regional Health actually sided with Strong Memorial Hospital. But that was an old article. It was from last year. But it just points out how fucked up the mental health system is in our country. Not just in Rochester, New York, not just in Genesee County and New York State or Monroe County where I live. Across the country, every psychiatric emergency room, almost without exception, is total fucking chaos. And I don't think they have any ability at all to judge when somebody's going to commit suicide or not commit suicide, to be violent or not be violent, unless they come in acting violent or come in after making a suicide attempt. And even then, you could put somebody in the hospital, they stay there for a few weeks, get out, and they still commit violent acts. They go back to using drugs and alcohol. They go back to hallucinating and becoming paranoid. They go back to not taking their medication. They go off and commit suicide. Don't get me wrong. I see a psychiatrist. I take my medication because it helps. It helps me prevent me from committing suicide. My sister committed suicide. My mother drank herself to death when she was mentally ill. I have no desire to die. I have no desire to commit suicide. But I don't think my avoiding suicide or avoiding violence has anything to do with the psychiatric emergency room. I usually go there just because I feel so agitated that I have to be around other people. And I go there, they give me medication, they calm me down, they talk to me, they send me home. In that sense, it's helpful. They give me some medication, I calm down, I go home. If I wanted to commit suicide, I could easily do so. If I wanted to harm other people, I could easily do so. And the hospital has no way of predicting that. I don't think any psychiatric emergency room has the ability to predict that. Unless somebody comes in actively already making a suicide attempt, or they're already high on drugs and alcohol, or they're acting violent when they come in, there's no way of knowing if a calm acting person or a reasonable sounding person still might commit a violent act, still might go back to using drugs and alcohol, still might commit suicide. I think the psychiatric emergency rooms could be more accurate in making predictions if they weren't so fucking overcrowded and they actually had more beds to put people into the hospital instead of discharging them into the community when they're high on drugs, when they're violent, when they're suicidal, when they're alcoholics, when they're homeless. I remember a time whenever I went to the psychiatric emergency room, sometimes I would spend 2 weeks in the hospital, sometimes 4 weeks. One time I spent 4 months in the hospital waiting for a group home, and it was good because it prevented me from being homeless. I had nowhere else to go. I spent 4 months in the hospital. I went to a group home. It worked out fine. They don't do that anymore. They don't hospitalize me for 4 months or 5 months or 7 months because they don't have the beds. And the psychiatric emergency rooms are overflowing. The system is broken. It doesn't work. And building houses and apartments for the mentally ill when they don't have any access to treatment doesn't solve the homelessness problem. It doesn't solve the problem of mentally ill people going to jail and prison instead of the hospitals. The only way this problem is going to be solved is if new hospitals are built across the country, mental health laws are toughened to hold violent people longer, and in hospitals that actually have beds to put them in. People need to be able to go to the psychiatric emergency room, have enough beds that the psychiatric emergency room isn't overflowing because there's no place to put them. The government has to build hospitals again. I'm a political moderate. I'm in the political middle. I'm not necessarily for a welfare state. I'm not necessarily a conservative. But like Ben Shapiro says, one area that the government should be involved in is mental health treatment. They need to rebuild state mental hospitals, not on the old model, of course, because those were shitholes. That's why they were closed. But closing them caused a massive influx of homeless mentally ill people and a massive influx of mentally ill people into prisons and jails, especially state prisons. And I suppose sometimes federal prisons. But this new spending bill that the Democrats want to put out, as far as I know, it has no money for new hospitals, psychiatric beds, new psychiatric hospitals, new psychiatric emergency rooms. It has no money at all to address how there are no hospital beds available for psychiatric patients, especially those who are violent or suicidal or high on drugs, high on alcohol. Until the government's willing to spend millions of dollars, billions of dollars really, and until private hospital corporations are willing to spend millions and billions of dollars to build new psychiatric hospitals, the psychiatric system is going to remain broken. It's not going to work. Apartments and houses for the mentally ill are useless if people aren't taking their medications and they can't spend time in the hospital to actually stabilize and get better and get a psychiatrist, a social worker, a therapist, a case manager. All of those things were arranged for me when I spent 4 months in the hospital. I had time to arrange those things and get an outpatient care system set up before I was discharged from the hospital and a place to live. They don't do that anymore. The hospital I spent 4 months in, it's gone. It evaporated. Not just the psychiatric department, the whole hospital. It was totally closed down. They had just built a new $450 million birthing center for pregnant women, and then the whole hospital suddenly went broke, and the whole fucking thing closed down. That just cut out psychiatric beds as well as regular hospital beds in the Rochester area. So the system's fucked up, and until the government and private hospitals are willing to spend $1 billion, it's going to stay fucked up. So why am I doing fairly well? Well, because I had patients to get on a waiting list for a psychiatrist, to struggle through my mental health issues without taking drugs and alcohol, getting a therapist, getting a case manager, getting the things that I needed to stabilize, getting my disability payments, getting my Medicare, getting my Medicaid. And I'm very lucky in that regards. I have a good support system. I go to a fairly good outpatient clinic. And I also don't want to be homeless in the winter. And it's been my experience that if I stop taking my medications, not only do I become suicidal, and not only do I become more combative, but I end up unable to function, and I become homeless. And believe me, I've been homeless in the winter before, and that was a direct result of not taking my medication. So in some ways I'm lucky, in some ways I'm just being smart. If I'm lucid right now, if I sound logical, if I sound rational, it's because I'm taking my medications, and I continue to take my medications. That's probably one of the single most important things that a mental health client, patient, consumer, whatever politically correct word you want to use, it's extremely important to stay on your medications and take them exactly as prescribed and not fuck around with it. So I just wanted to do an update. I didn't go to the psychiatric emergency room. I'm sorry for ranting. I don't do scripts for these videos. I just say what's on my mind, what's going on, how I'm doing, how other people are doing. And I just wanted to let everybody know that I was okay. Like, share, comment, subscribe, press the notification bell so you know when I put out new videos. And if you really, really, really want to help my channel, like these videos on the like button and share them on social media. You could use my videos any way you want to. I use common attribute trademark, which means I don't trademark my videos. You could use my videos on your own channel in any way, shape, or form you want. Praise me, criticize me, critique me, whatever. I'm just trying to get the word out. That's all. So if you want me to do a video on a specific topic, let me know in the comment section, and share these videos, please, on social media like Twitter and Facebook, where I do have a presence.